before we start off, and I think some of you know me, but some of you don't. I actually am a child and adolescent family psychiatrist in Sydney. So I'm a practicing clinician, and I've been a child and adolescent psychiatrist now for the last 28, 29 years, so has been quite a long time. Apart from running a private practice in both places in Sydney, one in Pimble and one in Castle Hill, I'm also involved in supervisions and training of psychiatric registrars, counselors and psychologists as well. And of late, I have been going overseas to do quite a bit of teaching, like coming to Malaysia, but also to China. And in fact, before Christmas, I was in China, in big teaching hospitals in China, teaching about child and adolescent mental health. So I was actually previously born in Penang, but have been living in Australia now for the last 40 years. So I basically practically spent most of my lifetime in Australia. But it is always a great thing to come back to an Asian country, to come to Malaysia, because there's still quite a bit of connection, not only about the food, but also about the culture. And I'm so glad that I can actually come and share with you all on this topic of school refusal. We have entitled that topic, The Many Masks of School Refusals, because at the end of the day, school refusals is just a description of underlying problems. And so because of that, in order to get down to the whole issue of school refusal, we really need to know what is behind the mask. And that is the reason why we talk about the many masks of school refusal. And each kid who has a school refusal will be quite different from another child who has a school refusal problem, because the child actually wears a different mask. But before I go on, I just want to introduce a bit of my website. I actually have put together a website called Healthy Mind Concepts, which I'm going to refer to from time to time during my talk. And on the website, there are some materials, articles that I've written on mental health, on different things like depression, anxiety, and there are also some what I call simple toolkits that you can actually download for free on breathing exercises, on communications, effective communications between mom and the parents and the adolescents. So those are some of the things. And apart from the simple toolkits, I've also put together over the years from my own experience a number of self-help toolkits for adolescents and young people and even adults with different problems, the anxiety and the depression and distressing emotions as well as emotions regulations. So in fact, at the end of today or any time during this seminar, if you are interested, there's a bit of vibration.
There's another one. Use the other one. There's two microphones there. They're both corners of the paper.
So just to continue, if you are interested to incorporate the toolkits in your clinical work, if you can just indicate on the piece of paper, there's a piece of paper with names and email addresses, and I hope that with sufficient interest, I might come back to do some training for that as well. So, but I leave that very much up to you. The reason why I have devised the toolkits, as I say, is because over the years, after I see some of my clients, they will be asking, what sort of homework should I do? Anything that you can recommend us? That is one reason for the toolkit. And the other one is that I discovered that in between sessions, a lot of times they may run into difficulty and they need to practice certain skills. And so because of that, I have actually put together the toolkits for that purpose. So not all school refusals is a school refusal. I entitled that, not all school refusals is a school refusal. As I said before, a school refusal, when we say that somebody is experiencing school refusal, it may just be simply a description of the student's behavior. Yet in another case, it could be symptoms of an underlying problems. So what are the symptoms of an underlying problem? It could be symptomatic of an underlying deeper distress, such as anxiety, such as depression, such as family issues, and such as wider issues within the school, or these days even a wider issues in terms of the cyberspace, because with the advancement of the information technology, our life these days is no longer limited to the geographical community that we are in. And in fact, we talk about globalization. So what happens in another part of the world can very much impact on us. And indeed, that is the case with a lot of young people. What happens within that cyberspace that is outside the geographical location of the child can very much impact on the child and lead on to a school refusal. So the salient point is, for example, the child who is deeply involved in gaming at night with another person around the other side of the globe, and as a result of that, there's a disruption of the circadian rhythm, and the next day the child just cannot wake up to go to school. So school refusal could be a sign of a deeper distress, or as I've said, it could be an indication of an underlying systemic problem. What do I mean by that? Because each of us do not live independent of our system. All of us belong to a family. And we live in a community, and within that community, right, we live in a country, and then our country has dealing with other countries. So each of us are beings within that multi-systems. So especially the case with young people. So when we consider young people in distress, we also need to consider the systemic issues, the different systems within the child's life. And in a child's life, there are different systems that come to mind quite obviously. So for example, the family is one system. The child hopefully goes to school, and there is another system. And the child a lot of times belong to other organizations. The child goes to youth group, the child goes to church, the child goes to scouts and various other sort of organizations. So in consideration of an individual, we must always consider an individual within a system. So once we get that right, we no longer look at the child as an independent being, then we move on to thinking about the system that the child is in and trying to understand the school refusal within that system. So with that in mind, I just want to illustrate my point by sharing with you some case vignettes. I'm going to present to you 5 case vignettes, and I'm going to go through them. And what I want to do is for all of you to write down, okay, as a detective. Clinicians are detective. Parents are very good at detecting, right? We know when our kids are lying, okay? And parents, and a lot of us are parents here. Do you tell a lie? I know that you've told a lie. You better tell me now, because if you don't tell me, I already know, okay? And most of the time, if the child is below 3, then the child believes in you and says, yes, mommy, I took the peanuts or something, okay? And then one fine day, the child discovered that, my goodness, mom and dad, they are not God. They don't know anything. They don't know everything, okay? So the discovery that mom and dad don't know everything leads on to a very healthy psychological life, okay? So if you don't have a child who lies, the child has a problem, okay? But if you have a child who lies occasionally, the child is normal. But obviously, if you have a child who lies all the time, then the child has a problem. So clinicians, right, we are there as detectives. So case vignette number 1. There's Nishan, he's a 15-year-old boy. He lives with his father, an older sister. The mother died, unfortunately, about 12 months ago from lung cancer. And he has excessive use of the computer. Like, he stays up late, like a lot of young people who have excessive use of the internet information technology. And the next day, he would refuse to get out in the morning. Initially, it was just being late to school. He would just rock into school, into the class, 1 hour, 2 hours after the class has started. Then after that, he would just refuse to go to school altogether. And now the father, who is at the end of his tether in managing this child, says that maybe a change of environment would be the solution. Because I have no authority over my son anymore, I'm going to send him to my sister, and maybe my sister and my brother-in-law would have some authority over him. Now, I just want you to be the detective. I just want you to write down on a piece of paper. We will come back to that at the end of the sessions, and just to see whether you get it right. Now, it doesn't matter if you don't get it right. That is the way that clinician works. Because with clinicians, as soon as the person walks into the room, okay, we observe the person. We ask the first questions. How can I help you? Or what is the problem? And we have ideas as the person talks, right? We think about what is this problem? It could be this. And as we engage with the person, then our diagnosis or our impression or our conclusions of the person's problem may change. So I've given you a brief case vignette. So just write down the diagnosis. Case vignette number 2. We have a girl called Sarah. She's 6 years old. And she lives in a nuclear family with a 2-year-old sister. So meaning that there are 4 of them in the family. There's Sarah mom and dad, and then there's a younger sister. Now, Sarah has been complaining of stomachache of unknown etiology. Medically, when you say unknown etiology, it just means that no known reason. So obviously, the parents have brought Sarah to see the family doctor and pediatricians even, and maybe pediatricians who specialize in different systems. So it would not be at all surprising to know that Sarah has actually gone to see a gastric physician. And all of their investigations and the statements have come back to say that, well, look, you know, there's a stomach ache there, but we don't know the reason, okay? So that is what we mean by stomachache of unknown etiology. She refuses to go to school. And for those days that she goes to school, then she would go to the sick bay. She would say that I'm sick. And she would just go to the sick bay persistently until the parents would pick her up from school. And in your consultations with Sarah, you found out that there is a very, very strong history of anxiety. So putting on your clinicians or putting on your detective hat as Sherlock Holmes, what do you think is the problem with Sarah? Case vignette number 3. Ali, he is 13 years old. He's a Form 1 student or Year 7 student. He has a very uneventful primary school life, meaning that he just was not under the, under the radar, as it were, we say, okay? So he was uneventful. It wasn't as though there's any problems that the teachers have actually notified the parents about, and that's uneventful primary school life. No behavioral problems, no emotional problems, no academic problems. And then when he started Form 1 or Year 7 in Term 1, he was okay. And again, there was no problem. So straight away, you know that he actually moved initially from that transitions of Year 6 or Primary 6 to Form 1, initially with no problem. Now, transitions is a very important thing in our lives because transitions require us to adapt. And when we don't adapt well, then it would have problems. So we talk about normative crisis. Normative crisis meaning that when we move from one stage to another one, which is normal. So for example, when the child moves on from a preschool to a primary school, that is one transition. And when the child moves on from primary school to high school, that is another transition. So with each transitions in our life, even though that transitions may be something that we welcome. So for example, we see that we are all adults. Some of us may be single. Some of us may be married. So when we move from a single life to an adult life, that is another transition. But it is a normative, it brings us normative crisis, meaning that because of the transitions, we need to adapt. So transitions usually bring about normative crisis for us to adapt. And when we don't adapt well, then this is where we have problems. Now, Ali doesn't have problem initially, okay? When he moved on from primary 6 to Form 1, no problem. But then at the beginning of term 2, he starts to refuse to go to school. Now, from your history and from the feedback from the teachers and the parents, you also know that he's a very pleasant, compliant, and polite child. And as you look into his history, then you found that there's no obvious events, or what we call stressors. Then there's no obvious events which may be responsible and which may be contributing to his school refusal. What do you think is the diagnosis? Case vignette number 4. A Chinese boy called Beng, and he's 15 years old, and he lives with his mother. It's a single mother household with an 18-year-old sister. And the mother has various physical problems, and she goes to see various doctors for various ailments. And apart from that, because the mother has a lot of physical problems, and being the sole breadwinner, she is constantly under a lot of financial hardship. And Beng's grandparents have to chip in order to help the family financially. Beng just won't go to school. And, but unlike a lot of school refusal kids, during days that he doesn't go to school, it's not like he would actually watch TV and play with the computer, eat his favorite food, raid the kitchens and, you know, indulge in overeating. No, no such thing. So he just would stay at home, okay? And it's not as though he's using the computer excessively or watching TV excessively. The mother is very supportive of the son's therapy. But the mother is also concerned that, hey, maybe Beng is a bit like me, and maybe the doctor got it wrong, and he has physical problems, and the doctor at this stage has not been able to come to a diagnosis of Beng, and maybe it's because of that physical problems that he can't go to school. What do you think is the diagnosis? Last case vignette is Lydia. She's 17 years old, and she lives in a nuclear family with her parents and 19-year-old sister. Again, her school life is uneventful. So she's 17, so in your context then, she's probably Form 5. Or in the Australian context, it could be Year 10 or Year 11. So over the period of her educational life, from kindy or kindergarten up to then, no big issues that have caused alarm for the parents or for the teachers. And she identified herself as dumb. And she shows, indeed, when you go through the school reports, and she shows poor academic record. The parents are blue-collar workers, so they are not professional people. They are not white-collar people. So the parents are not too concerned about Lydia going to school or not, because as far as they are concerned, well, look, you know, if she doesn't go to school, she can always drop out and she can always come out, and then she can work just like them, you know, get a job in a factory or get a job somewhere and serving in a restaurant. So the parents aren't too concerned. What do you think is wrong with Lydia? So with all your diagnoses written down, we will come back to that later on. And let's go back to this whole issue about the mask of school refusal. In consideration of the mask that the child is wearing, normally we like to consider in a very broad way 3 factors. Number 1 is the stressors, right? Stressors. As I mentioned before, stressors are life events which may contribute to the child's school refusing. Now, life events could be something normal. As I say, transition from one to another one is a specific sort of life event that is normal. Or it could be extraordinary life events. So one possible stressor might be parents getting divorced. And one chronic stressor might be parents who are in chronic marital problems And as a result of that, the family environment is pretty chaotic and is pretty stressful for the child. So that would be one stressor, okay? Or it could be extraordinary stressor of losing someone, a bereavement. Or it could be the impact of mom or dad being unemployed. Or the stressor could be an ongoing one, such as the parents having psychiatric problems. So one or more parents have a major psychiatric problems of schizophrenia or even a bipolar disorder. And sometimes the stressor of the parents having specific personality disorder, and as a result of that affecting the family. So you like to think about stressors when you think about the mask. Then you also want to know about the person. I presented to you 5 case vignettes, right? So there are some personal things, and you have to be thinking about, look, what is this about this person? What is in this person's history that I can get into so that I would know what is the mask? So personal history, knowing the person is very important. And in knowing the person, obviously, we want to talk to the person, and then we want to talk to other people. We like to look at some evidence of the child academic performance as well, because school refusal has to do with the school. So, you know, you'll be wondering, how is this child going on? And is the school education being affected? So there's the personal issues. And as I mentioned before, because the child does live in a system or in many systems, then another big group then is what we call the systemic issues, okay? So you like to kind of know that whether there are any specific problems within the systems that the child is in. So those are the 3 big groups. And then you want to concentrate on the mask. And how long has the child or the adolescent been wearing the mask? And when did it start? Because obviously, with school refusal, there will be a time when the school has noticed that the child is not going to school, or mom and dad sort of notice that, well, the child habitually refuses to go to school. So the onset. And you also would like to know a bit about the cause, all right? And how is it going on? Is it fluctuating? Is it now that, you know, for the last term, the child has not been going to school at all? So the child has not been going to school for the last 10 weeks. So in all these things, then you consider what happened before the school refusal, or what we call the antecedent event. And then you look at the behavior and the subsequent behavior. What do I mean by the subsequent behavior? So for example, I know as a fact that on a worldwide basis, that a lot of kids who are school refusing, a lot of them develop a secondary problems of excessive use of information technology or too much screen time. At least that is the case in developed countries and developing countries where kids have access to screen, whether it in the way of a smartphone, a Samsung, or an iPhone, or in the way of an iPad, or in the way of a personal computer. So what are the subsequent problems? The other subsequent behavior could be overeating. So again, it's not uncommon that you see somebody in your consulting room who has a school refusal and who has developed a binge eating disorder. Because the person might be watching TV, using a lot of screen time on the iPad or on the PC, and then you'll be eating a lot of junk food. So, and then we'll be binging. So there's a binge eating problem, then there's an overweight problem, and then there's the obesity problems. And so you like to know what are the subsequent behavior as a result of the school refusal. Then you also want to know the family solution. Now that actually gives you a very, very good indications as to the problem-solving ability of the family. So what has the family been doing? Have mom and dad been threatening the child? Has the father been beating up the child in order to get the child home? Or have the parents thrown up their hands and say, I can't do anything about it? Or have the parents actually enlisted help from a system outside the family, like, for example, extended family being involved, or church pastors being involved, or youth leaders being involved? So what is the family solution. And how many professionals have been involved? Now that is very important. Are you the first person to see the family? Or are you the third and the fourth and the fifth person to see the family? And why is it that previously the other professionals could not offer a solution? So in other words, then, it leads on to the next questions, especially if mom and dad say that, well, you know, I brought him to see psychologists and counselors, and they're of no use. They don't help at all. Then your next questions would be, well, what is the most useful thing? Okay? So you actually have to tease it out rather than for the parents to tell you and say, it doesn't work. Because somewhere along there, okay, there might be something that works. And if there is something that works, then you have to know how long has it worked. Because then that will help you to map out the course, as it were, and say that, look, you know, the school refusal started at this, and then the course is like this, and with certain intervention, there's some partial response, and after that, there's a relapse. So once you have mapped out that course, then it actually makes it easier for you to plan and to see where you actually fit in. And that is very important, because by the time you take up the case, or by the time you get involved in this person's life, you become part of the system. So you like to know what are the influences within the system that you become part of. So then it is very important in that personal way to talk to the child, or what I call the protagonist. What does it think? Does it feel that there is a problem? Some kids don't feel that there's a problem. They might be quite happy staying at home. But more often than not, a lot of them would feel that there is a problem, and there's a struggle within them of refusing to go to school, but also wanting to go to school. And what is the person's solution? And some of the young people may have certain solutions. They set the alarm, or they remind themselves that they have to go to school, or the night before they write themselves promise notes that says, I promise myself to go to school. So what is the solution that the young person has to overcome the school refusal? And with that solution, what are the long-term consequences with that solution? So the other thing which is very, very important is who is actually worrying about the problem. As I said before, some kids, they are not worried. It's the parents' issues, right? So they are not worried, because I've seen some kids who refuse to go to school, and they say, look, you know, I still do the homework. I still go online. I still do the English. And I'm still learning. And sometimes I have seen some kids who may even say that, look, yes, I've been refusing to go to school, but I actually turned out for the assessment, and I'm okay with it. So as far as I'm concerned, there's no problem, because I'm still getting an education, despite the fact that I'm missing out on 80% of the school attendance. And with that, does the child want to see a therapist? And what is his expectations of seeing the therapist? So you want to know about that. And then you also like to know, come in and engage with the child, and to know a bit about the child. Okay, so this is where your focus then is shifted away from, you have a problem and I have to fix the problems. Okay, you want to kind of get alongside him and ask him, how is life so far, you know? And what is the best bit about your life? And what is it like being in a family with a single parent family? What is it like to be in a family, in a nuclear family, where dad is not around because dad has this high-power job? Or what is it like in a family now that you have 3 or 4 younger siblings and you have to help out mom and dad with the housework? So how is life so far? The highlights and the life events. And you also like to know a bit from the child's perspective whether life's been good in terms of personal illness, not only with himself, but with the family. And that is very important with family illness. Like, how is mom going on, you know? Mom has this problem, mom has this heart problem, and mom has been going to see the doctor now, and the last time she actually has to go in the hospital for difficult investigations. And the last time she actually has to go in the hospital to have this procedure. And how is that going with his leukemia? because now the doctors say that they need to have a bone marrow transplant. And how do you feel about that? Do you understand what is bone marrow transplant? And are you concerned about dad's illness? So you like to know about that. And you also like to know about the life goal of the child and what motivates him and what is his passion. What does he want to do? Now that is actually very, very important, because if the child has a passion, then you have something to work on. But if the child doesn't have a passion, then it's hard to be working on something. So you like to know about the protagonist, and then you also like to know about the significant others. I call that significant others rather than just the parents, because whilst it is true that in a lot of cases in a child's life, the parents are supposed to be the significant other people, but in some of the children's life, the significant others may not be the biological parents. So this is where we talk about the psychological parents. It could be an uncle, it could be the grandparents, or it could be a church leader, it could be a youth leader, okay? And it could be somebody else's father or somebody else's mother. So the significant others in the child's life. And what is that person's narrative about the school refusal? And how has the young person been helped by these significant other people? And what do they think about professional people being involved? And last but not least, would the significant other person or the parents be willing to work with me? This is where you actually need to know about that. Now, school refusal can be a very, very tricky thing. So sometimes the significant others or the parents may bring the child to see you so that they get a tick, okay? So in Australia, I don't know about Malaysia, in Australia, the child psychiatrists still have a lot of authority, okay? That makes me feel good. And a lot of times, right, the child may have been to see counselors and social workers, and the school would insist and say, well, look, you know, you need to get a letter from the doctor, okay? And your name is given, you know, Dr. Lai, you know, and they have to go and see Dr. Lai because he's the authority, or he has, you know, the child has to go and see Dr. Tan because, you know, he's the child and adolescent psychiatrist in Kuala Lumpur, and he's been dealing with children, okay, for the last 10 years. So, and sometimes the parents may bring the child to see you because they just need to have the tick, okay, to prove to the school, because the school puts a lot of pressure on the child, then the parents may not want to work with you. Such is the paradox, okay? And don't take it for granted that just because you have a child and the parents sitting in front of you, that there is a contract for treatment. And sometimes it's not, okay? Sometimes it's just a matter of telling the school that, well, I brought the child to see Dr. Tan, and really we have seen Dr. Tan for 3 sessions now. Nothing has changed, okay? Dr. Tan told us to do all these things, and we know it all before, and nothing has changed. So be very, very wary, and always, always suss out, right, how the parents are going to work with you or not, and the degree to which they're going to cooperate with you, not just what they say. So then you obviously want to go on now to assess a bit more about the system. Now I have to use the one with the wire.
That's the last one, huh?
The many masks of the presenter. Now I'm the one with the wire. So, so now we consider the family. So the family is actually very important because the family is the immediate system that the child lives in. So the first questions, right, which you can actually tell even from the registration, right, is what type of family that the child lives in, okay? Now we live in a rather complex world. Maybe for a more conservative society like Malaysia, you are not as complex, but the last count, okay, in the Western world, there are 28 types of families, okay? And so there are 28 types. Don't ask me to tell you all the 28 types, okay? I can tell you a few types, right? So we have nuclear family. We have single parent family, which we all know. Then we have blended family, right? Blended family are when two, a man and a woman come together, they have their own family before, and for some reason it was broken up because of death or divorce or separation, and now they come together and they bring their families together. So that's the blended family. And in a Malaysian context, right, it's not uncommon to have intergenerational family, okay? So you have mom and dad, and then grandma, grandpa, and in some cases, it may even involve aunties, uncles, and cousins, okay? Huge kind of intergenerational and extended family. And then, of course, then, I think I mentioned about the single parent family. So these are some of the families. Now, some, as we know, right, different families usually have different problems because of the difference in the way of resources or the deficiency of resources. So for example, we know that most of the time, right, with single parent family, there's a lot more stress because the single parent not only has to go out to be the breadwinner, but also to manage the entire household. So generally, right, they are under a lot more stress, and generally, they are kind of like, in a way, of a lower socioeconomic status than the nuclear family, because in a society like Malaysia and in developed countries, and if both mom and dad works, then they have a combined income. So by knowing the sort of family, then you kind of like have some hypotheses as to the possible problems. So in a society like Malaysia, for example, if the child comes from an intergenerational household, then there could be a lot of problems about authority, about boundaries, okay? Because of grandparents who may want to interfere or who want to get involved in the child's life. So it's not as clear-cut as a nuclear family. And then in a blended family, which is quite prevalent in a Western society than the Eastern society here, right? In a blended family, a lot of times, again, you have different problems. So in my practice, I've come across a lot of blended families where the kid would find it very, very hard to accept the coming in of a step-parent, okay? So for example, a boy who has been spending a lot of time with his single mother, by the time he's 12, then mom decides to form a family with another man, and the man comes in with his other set of his own children. And the boy, a lot of times, finds it very hard to accept the authority of the stepfather because he have been the male in the family, okay, system for the last 12, 13 years, and he's not going to give up that power. And a lot of times, then the stepfather, in order to prove that he is the figure of authority, would want to exert his authority over the stepson. So by knowing what sort of family it is, then you can more or less kind of say, look, you know, maybe these are some of the issues that I have to identify. Then, of course, the next thing is the life stage of the family. At what stage is the family in? So we know, for example, for a simple fact, right, when a man and woman come together, they actually form a family, okay? So there's something which is a bit unusual, you know, in our usage of the word. A lot of times when a man and woman get married, it's not like they don't say, we're raising a family now, you know? When they say, oh, we start a family, meaning that, wow, you know, we're going to have kids, right? But even before that, even before that, they're actually a family unit without kids, okay? So you have the stage of family units with young kids, family units with adolescent kids, family units where mom and dad are launching the kids, then you have family unit with adult kids, okay? And sometimes, some family, the life stage could be a bit mixed up. So for example, it's not unusual that you have one or more adult kids and then mom and dad decide to have other children. So in that case, then some of the kids are actually launched and then they still have a family with one or two in terms of kids, you know, who are actually going to school. So by knowing the stage of the family, then again, you know what sort of task, we call that task, that they have to do, that mom and dad have to do, and how is the task impinging upon the life of this young person. So the stage of the family is very important. And hierarchy is very important. Typically in a family, right, you have mom and dad being on the top, being the figure of authority, and then you have the system of the kids. So the hierarchy. But sometimes in a lot of families, the hierarchy is actually turned the other way. So just because they're biologically their mom and dad doesn't mean that they are the one who are the power broker. And in fact, a lot of times, in the case of family refusal, you have this 7-year-old kid, this 8-year-old kid or 12-year-old kid who is all powerful. And mom and dad then have to succumb to the power of the child. So what is the hierarchy in this family? Are mom and dad actually exercising the authority? And how about the subsystem? Are mom and dad functioning as parents? So in other words, are they forming a parental subsystem with the subsystem of the children? Or is one or more of the parents in alliance with another kid? So it's not uncommon, for example, in the case of a man and a woman who have marital problems, then one of the spouses actually form an alliance with another child against the partner. So mom may be forming an alliance with his son to go against the father, or the father is forming an alliance with the daughter against the wife. So again, you have to know all these dynamics. And what is the problem-solving ability of the people within the family? So when they have a problem, how do they go about solving the problems? Do they do it in a way that is democratic, or they may not have any problem-solving skill because mom and dad just say that, well, you got to do this. Why do you have to do this? Because you got to do this. But why do I have to do this? Because I'm your parent, okay? So that is the degree of the problem-solving, right? So problem-solving skill. How about conflict resolution, right? How do they resolve conflict? Now, this is particularly important in terms of adolescence. The reason why this is particularly important for the adolescents is that in terms of the psychological development of the adolescents, their energy is more directed outside the family, okay? Talk to any parents with adolescents, they will tell you that, right, the adolescents think that they're dumb, you know, the parents are dumb. They don't know anything, okay? Mom and dad, you don't know anything, okay? But more often than not, actually, mom and dad don't know a lot about computer, right? And so a lot of adolescence is directed outward. So because of that, there's a lot of conflict with the adolescents. And how do they resolve that? How do they resolve the late nights? How do they resolve peer activities? You know, when the child persistently wants to spend a lot of time with the peers and not being at home. How do they resolve the issue of the adolescents not participating in doing the housework? How do they resolve the issues of a common problem is like the adolescents not keeping his room clean? And the other one, which is very common, and I think it is present as well in a Malaysian society, is how do they resolve the issue that this person, this adolescent child, consistently just wants to shut himself or herself from the rest of the family. He refuses to go out to family outings, and he just spends a lot of time in his room. And mom and dad say, I don't know what he does in his room. He just shut the door, okay? So that is a conflict. How do they resolve that? And how do they communicate with each other? And that is very important in terms of your assessment. And then the school is very important as well. The school is very important. What sort of school does the child go to, right? And with that, I have to say that probably the Malaysian system is a bit more confusing. In Australia, okay, we only have a few types of school. We have the private school to start off with, and the public school. And in Australia, unlike Malaysia, the private schools, they actually take in very good kids because the parents pay for their education. I did part of my education here some years ago, all right? And I went to a school called Chung Ling High School. I didn't actually finish, and I was quite glad to leave because when we went over to Malaysia, I actually to Australia, I actually had a very easy time, you know, because the academic requirement is not as high. And so during my time, I know that Chung Ling has Chung Ling Private School, okay? And the good kids all go to the public school. And the not so good kids go to or went to private school, okay? That was during my time. And in Australia, it's different, okay? You have private school kids, then you have public school. And then among the public school, then we have what we call selective school. So you have to do the exams, okay? You got to be good. You got to be the cream, okay? You got to be the creme de la creme, okay? In order to get in, and there's one called James Roos in Sydney, right? And there are lots of Asian kids there, you know. If you stand behind the classroom, they're all mostly black hair, okay? And because Asian kids, you know, the parents make sure that they go to the best, okay, the cream of the selective school. But I know that in Malaysia here, right, and this is not a criticism, you have many different sort of school. I was having conversations, you know, with some people just a few days ago when I was in Penang teaching, right? You have different sort of school, and it could be quite confusing. What sort of school, right? And I mentioned before Chung Ling. I went to Chung Ling, and I actually felt a lot of pressure because Chung Ling was the top Chinese school, and I believe that it is still the top, okay? Can you imagine if you go to a school like Chung Ling, okay? Now you may have an IQ of 130, and then you sit in the room, okay? And with 130, you're just ordinary. You go to a not so good school, you're 130 IQ, you sit in the room, right? You don't have to do anything, you know? You can answer all the questions. You feel so good about yourself, with your self-esteem, right? But if you go to a selective school, if you go to a high-power school, right? Even with an IQ of 130, you feel like you're dumb. So that is very important. What sort of school? I saw somebody, this is 2 or 3 years ago, right? And she refused to go to school, right? I mentioned before to you that in Sydney, the top selective school is James Roos High School. And guess what school she went to, this girl who refused to go to school? She went to James Roos High School, okay? And she was very ordinary. And she considered herself dumb, okay? And so I have quite a lot of difficult time trying to motivate her. But anyway, she managed to finish her HSC, or what we call the year 12, okay? That is the one just before going to uni. Now in Australia, when you do your HSC, you're given an aggregate score of 100. Nobody get 100, okay? You usually get 99 point something. And in order to get into medicine, you need 99.7, okay? Guess what aggregate score she got for her HSC? She said that she was dumb, okay? I managed to get her through to year 12. Guess what aggregate score did she get? Sorry? 90? 99.9? 99.6? She got 99.5. Okay? She got 99.5. So in James Roos, right, almost every kid would get above 90, and a lot of them would get through 95. So 99.5 is not the top. Okay? You wouldn't be what we call the ducks of school, right? Because there'll be kids who get, you know, there'll be more kids who get 99.6, there'll be more kids who get 99.7, then there will be a lot of kids who get 99.8. So she considered herself dumb. So the school is very important. What sort of school, right? And by knowing what sort of school and how the child fits in, that will give you an idea about the stress. And the class, the power brokers in the classroom, peer relationship is very, very important. I talk about social ladder. Now, as adults, and even for professional people, we must not underestimate the degree of peer pressure the adolescence is under. I have cases where the adolescents, right, threaten suicide, put it on Facebook, the whole school got alarmed, you know, and he went away, and they have to send out police to look for him. And that is because he was ostracized by his peers. I have kids who get so depressed, okay, because the child or the adolescent does not belong to a social group that he desires to be in, or what we call the cool group. I'm not too sure in Malaysia whether you have cool group. In Australia, we have the cool group. So you have young people who refuse to go to school because they are not in the cool group. You have young people, right, who are not the power broker in the classroom and who has problem going to school. So never underestimate the problems with peers, the peer problem, the power brokers, and the teachers, the opinion of the teachers as well, and the relationship with the students, and the amount of curriculum and the performance and the extracurricular activities. I'm not too sure about Malaysia, but in Australia, we have lots and lots and lots of Asian kids, okay, who come from very well-to-do family. And some of these kids have tremendous pressure at school. They have tremendous pressure at school because the parents have enrolled them in numerous extracurricular activities, such as the swimming, such as the violin. You have kids who play 2 or more instruments. So the first one is always either, this is in Australia, okay? The first is usually a piano, okay? So if the child can cope with the piano, then the violin, okay? Or the first one is the violin, and if the child can cope with the violin, and then the piano, right? And other things as well, and the swimming, and so there are heaps of extracurricular activities. And the child feels very pressure. In Australia, it is not uncommon to have what they call Saturday tuition school. Now, the Saturday tuition school is very intensive because the school is there to prepare the child academically. And it goes for half of the day of the Saturday. So you have kids who go to selective school, who goes to private school, and then they have heaps of extracurricular activities. And then on a Saturday, then they have to turn up. And so what they have left is only a Sunday to relax. So the amount of extracurricular activities that the child is involved in. So you want to know about that. And that could be the contributing factor to the child's school refusing. So I want to talk about some special considerations that we should be thinking about. Just because a student presents with a problem doesn't mean that the student has a problem. So it's kind of pretty wise saying. Just because the student presents with a problem does not mean that the student has a problem, because the student could be a flag bearer. So that, in other words, the student is actually waving a flag and say, hey, look, you know, I have this problem of school refusing, but please look beyond that, because there's problem in my system, there's problem in the class, there's problem with the school, there's problem in my family. So because of that, then you have to ask yourself, who is the real patient here? Just because the school has identified Abeng or Lydia or Sarah as the patient, who is the real patient rather than the identified patient? And who is the customer? Who is the one that is going to receive treatment from you, okay? Who's the one that is going to really get into what we call a therapeutic contract with you? So just because mom and dad bring the child to see you doesn't mean that they are ready to engage you. And who is the victim? And who is the rescuer in the family? So with that, then hopefully, then you are able to arrive at certain conclusion and say, what are the things that's lying behind the mask? Is there, do you have a boy, or do you have a students who have chronic health problems? Or do you have somebody who actually have mental health issues? Could it be a depression? That's the reason why the child finds it hard to get up in the morning, especially with what we call melancholic depression. Typically, the child, when he wakes up, he feels as though he has not slept the whole night. His energy is down, his thinking is darkened, and he thinks that there's no hope for him. But as the day goes on, then with a chemical increase in the bloodstream, then the person actually feels better. So is that a depression? And a lot of times, it could be a prodromal phase of a psychosis, such as schizophrenia. Typically, in the case of young people, right, who are 13 and 14 years old. So this is where there's a first onset of psychosis. And, or could it be a social phobia? Simple case of social phobia. The child just doesn't know how to relate to people. And so he doesn't want to go to school because there are just too many things for him to do socially in order to manipulate the interactions. And is there family history of psychiatric problems? So for example, we know that if mom and dad has one or more major psychiatric problems, usually then it would increase in terms of the child being predisposed to psychiatric illness. And I talk about the psychosocial issues of early upbringing and with trauma. When the child has trauma earlier in life, the more likely the child has major mental health issues. So kids who have been abused, kids who have been through major trauma, a lot of times struggle with depression later on in life and struggle with anxiety. And the social issues, the social thing of the family system, the school system, and last but not least, the cyber system is very, very important because the cyber system can impact and impinge upon a child's life. So with that, if you think that there is the likelihood of some anxiety or depression, then you would want to do some screening tests. Okay, you would like to do some screening tests to see whether the child has a stress, have an anxiety or depression. So with that, if I can introduce you to a very simple screening test that I put together, which I use, okay? So if you have data, would you like to take out your phone? Okay, if you take out your phone and if you have sufficient data, and then if you can log on to healthymindconcepts.com. Have you got it? You got healthymindconcepts.com? And then if you look at the left hand on the top, you would see 3 or 4 lines. That is a menu. You touch that, then you get a drop down on the left hand side. And then if you select management tools, you touch management tools. Then, are you all with me? Then it would say check my mental health. Okay? So when it says check your mental health, then there are 3 of them: anxiety, stress, or depression. Now I just want you to try, okay? Just pick any one. It doesn't matter which one, okay? It's just for you, all right, to try. So you can choose anxiety or depression or stress. So you tap on it, then the screen will come on. It's kind of a little black thing. If you tap on it again, then it will say, let's get started. Got it?
It's slow, some of
Okay, but some of you've got it, right?
How many of you are on the web page?
Yeah.
Then have you got what's the next part?
So yeah, you've got the web page. Then the next thing is choose the menu, the drop down, right? That says management tool. So you tap on the left hand side on the top. That's the menu. Have you all got it? Okay. Then you have a drop down. So tap on the one that says management tools. You got it? How many of you got it? Okay, good. All right. So once you tap on management tools, then it will say check my mental health. Okay. You tap on that. You got that? Okay. Then you choose one. Okay, because you say check my mental health, then there'll be the anxiety scale, depression scale, stress scale. So you pick any one. I just want you to pick one. Okay, and then a separate screen will come on, and then when you tap on that, then you have a series of questionnaires. Yep, tap on that one. Okay, you tap on the black screen. Then the orange screen will come on that says, let's get started. Okay? Then you will be given some questions. So I just want you to answer that. Just make it up, okay? You can say, not at all, I'm so healthy, I don't know what the doctor is talking about. Sorry, but there's no comment there. Oh, okay? So just answer the question. It's only 6 questions. The 6 questions will be, usually the response is not at all, a little, occasionally, frequently, all the time. Yeah? You would find that it's easier if you turn your phone horizontally. If you turn it horizontally, then the writing becomes bigger. Are you in one of the scales? So how many of you have finished the scoring? Good. Are you happy with your mental health? Okay. We just give the others a bit of time. It's just mainly for you to experience that. Okay? So if you suspect, for example, that the person sitting in front of you is stressed or have an anxiety or have a depression, just do that. Yes. David, can we have a microphone? Can you speak in the microphone? So there's a question. Sorry. Can you beginning again? Can you begin? Can you begin again? Can you just repeat that?
Oh yeah, one of my worries sometimes in sessions, I work in a school when I get students to have this free online test, that the validity and reliability of it obviously in the background, so that it doesn't fall into one of those quizzes where they take and then say something and then you really overwork them. If you can just let us know some background behind.
Yes, that is a very good question. So, what? Sorry, your name is.
Stephanie.
Oh, so what Stephanie asked is basically she's saying, look, because there are lots of screening tests, so how reliable is this and the background? Okay. So these 6-item questionnaires are the one that I've tested on my patients. So they've come in out of a group of patients, okay? I make the diagnosis clinically first, and then after that, I went back to construct the questions and the symptoms. So in that case, right, it is reliable and valid, okay? So it's actually based on my clinical diagnosis first of all, and then I select out some of the questions or some of the factors, like for example, I don't feel at ease or at all, and I'm restless, and so it is from that experience. But I have to say that with any sort of screening test, that's why I use the word screening rather than diagnostic. Okay, so the screening test is actually the first stage. So in medicine, there are lots of things that we do for screening. So, for example, in terms of a physical thing, okay? So a very common screening test physically would be a bowel test for bowel cancer. Now, just because it is positive, the doctor still cannot say, oh, you have a bowel cancer, because there's a lot of reasons for this, for the positive. So the same thing with the screening, but it actually just helps you to, sort of narrow it down, that is one. And a lot of times too, it actually helps you when parents can see something, okay? But obviously, you cannot make a diagnosis on a 6-item screening test. But it helps you to move on, to become a bit more focused. Okay? Yep. So, should we move on from there, or do you have any other questions about that? It just makes it very easy because you can actually access it and it's a very quick one rather than pulling it out. And also that is one. And the other thing, why it's easy, because a lot of times, a lot of professional people, they spend such a lot of time doing research on the questionnaires, so you actually have to pay. Like, you know, you have to pay like $5 in order to do 10 items questionnaires, okay? So with this one, it is different. It is just to help the general public, okay? So even the public, they can actually log on to that. But obviously, the idea of the screening is for them to lead on and say, hey, I have a depression, I have an anxiety, I have a stress problem, what should I do? So with that, then you can actually go on to what we call an assessment, okay? So with a screening, then a lot of times you may need to go do what we call psychometric assessment, the IQ of the person, okay? And the subtest of a psychometric test is going to tell you the strengths and the weaknesses. So from there, then you can also make diagnosis, for example, of learning difficulties, right? So that might explain to you why, if the child has a learning difficulties, if a child has a expressive language problems, so no wonder the child would not want to go to an English class because, you know, the English teacher has the assignments of presenting in front of the classroom. So you go on to assessment, and then you go on to do some academic testing, the reading and the maths and the comprehension. Again, it's very important because if the child is behind in maths, so obviously he's not going to go to school during those days that, you know, there are 2 or more periods on maths. So it just helps you. And the more detailed one would be the child behavior checklist and the ADHD checklist as well. Kids who have ADHD, a lot of times they will want to go to school because they can't pay attention. And obviously, this day and age with autism spectrum disorder is very, very important. I just want to make a special mention about autism spectrum disorder. When a person receives a diagnosis of autism spectrum disorder, more often than not, okay, and I would have to say that in my practice, right, I have not seen the not, okay, more often than not, the person has anxiety. Okay, you can take it for granted. And sometimes the person may refuse to go to school because of the anxiety. I have kids who have ASD who doesn't want to go to school because he doesn't want his friends to ask him and say, hey, how are you going? And he doesn't want to go to school because he can't handle the lunchtime where he has to sit down with his friends where they have to ask him questions. I have kids who don't want to go to school, okay, because, you know, he is afraid that the teacher is going to ask him things and he doesn't know how to answer that. So just be very well aware that a lot of ASD kids have anxiety problems and they also have frustration problems, but that is another topic in itself. So with that, then we come back to the formulation of asking the question why, right? Just because the child has a problem doesn't mean that the problem has to appear at this moment, unless you're going to ask yourself why, okay? Yes, the child has ADHD, but why now? Why not last year? The child has ASD, okay? And the child has ASD since he was 6, received the diagnosis since he was 6. Why does it happen now when he's 14 and he's starting to refuse to go to school? So unless you ask the question why and why now, then you're not going to go to the next 3 items, which is very important, okay, in your consideration of the formulation. We talk about the predisposing factors. So in other words, what is it about this child that makes him more likely to refuse to go to school? That is what we call predisposing, okay? So kids who have early childhood trauma, kids who come from lower socioeconomic status, kids who come from disrupted family, kids who have parents with 1 or more major psychiatric problems are more likely to have significant mental health issues. So those are the predisposing factors. And the precipitating factors are the things that tip the child over, okay? Something happened at that point in the child's life. So for example, if the child has significant predisposing factors, and then mom and dad finally make their decision and say, oh, look, you know, after 10 years, we're not going to be living with each other anymore. It's hell. We're just going to leave each other. Now, that is sufficient to push the child over to refuse to go to school. or mom or dad, have significant issues, and then there's a bereavement issues as well. So, and then you have the perpetuating factor. I mentioned before the inappropriate use of the information technology perpetuate the school refusal. So once you understand all those things, then you can formulate well. So let's go back. How much time do I have, David? How much time do I have, David?
Do as much as you need.
All right.
Morning tea is another 10 minutes.
Okay, 10 minutes. Do you want to go home? Okay. Let's go through it quickly, okay? So, case vignette number 1. What do you think is wrong? What is your formulation? Diagnosis. Sorry, diagnosis is different from formulation. Diagnosis is the label, and the formulation is the why, okay? Depression. Depression. Anybody else? Grief, yes. Abnormal bereavement, yep. Depression, abnormal bereavement. Anything else? The other possibility is that the child may have a pre-existing poor relationship with the father. Okay, so there's substantial systemic issues where mom formed an alliance with the child, and now the child has lost a very, very powerful person in his life. So then he has to deal with the father, or now he finds that he doesn't have a relationship with the father. But yeah, so those are some of the things. So next one, diagnosis. Separation anxiety disorder. Anything else? That's good. Separation anxiety disorder, or it could be what we call over-anxious disorder, which is the equivalent of the childhood version of a generalized anxiety disorder in a child. So separation anxiety disorder is where the person finds it hard to separate from another person who is the figure of security, okay? Whereas generalized anxiety disorder is the person is just crank up, generally anxious about most things, right? And of course, the other one is the transition of having a sister who is now a toddler. So it could be losing the attention, okay? It could be as simple as that. But the strong family history of anxiety points to some early manifestation of anxiety problem in this child. Next. What is the next one? Maybe I just shout. Hey? It's off. The mic is off. It's a speaker problem. Okay, what's the next one? Diagnosis. Just pull it out. Transition of a normative crisis. Transitional problem. Any other taker for anything? Just pull it out, David. Just pull out everything. Don't worry, just pull out everything. All right.
Bullying in school.
Bullying? Bullying at school, yep. Anything else? Possible? Yes, I think that is very good. Because when a child is in yes, it could be an intellectual issues because the child would have survived year 6 years, and then going to high school, the child finds it a lot harder to deal with. Yes? Anybody else? It could be. It could also be social phobia because, you know, with the child's life going to the high school, going to high school, the child actually needs to have a lot more in the way of ability to interact socially. Next. What is the diagnosis? No taker? A prodromal phase of a psychosis. Possible, 15 years old. Yeah, you want to exclude that? So, the responsibility that he has to take on at home, yep. He could be depressed, correct? Which is quite true, because mom has physical problems and the parents separated and the family is not doing very well financially. Yes? Or the other one, it could be some role modeling as well, because mom has a lot of physical problems. So then, you know, he also then has issues. And also because mom is concerned about him having physical issues, so mom has already identified him as a patient. So then he will continue in that abnormal sick role behavior. Okay? So in psychiatry, a lot of times we also talk about sick role, right? A sick role is the position that the person has assumed as a result of an illness, which is different from an illness. Okay? So when you have an illness, you might. So with an illness, right, you have to adopt the role of a patient. But some of us, that role could be very abnormal, and we might either exaggerate it. So he could have an abnormal sick role behavior. Next.
Attention deficit disorder?
Attention deficit disorder. Yes, possible, because it could be undiagnosed. Because the case, especially for female, who have inattentive sort of ADHD, they are a lot of times underdiagnosed, okay? Because they don't wave the flag that I have a problem. And they sit there quietly and they say they're dumb, and people will say, oh yeah, she's dumb, you know? She should be doing more like domestic science or rather than the English and the math. So she could have an ADHD inattentive type. Anybody else?
Systemic issue, parents are not motivated.
Yep. And sometimes it could be the family expectations. Family expectations, okay? So sometime years ago, I actually worked as a community child psychiatrist in the West, in Sydney. This is like when I first came out 20 over years ago. So in Sydney, if you are in the West, normally it's a poorer sort of socio-economic sort of family. So when I was there, right, I saw a lot of families where a 17-year-old have no expectations of finishing school. They have no expectations of going to TAFE. TAFE is one step lower. And definitely no expectations, all right, of going to university. Then I also have seen families where there is multiple generations of what we call welfare recipient because of the role. So a lot of the kids then I saw, okay, and who look forward to leaving school, who look forward to 18 years old, and then who look forward getting an unemployment benefit. So, because the whole family is like that. So there are expectations, okay? So that's very good. Now you can give yourself a pat on the back and you graduated and you are an expert in school refusal. So thank you very much for giving me this opportunity to share. And I've left my email address there if you have anything. So it's drwong@healthymindconcepts.com or drkamwong.hmc, which is Healthy Mind Concepts, and @gmail.com. Thank you very much.